This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hi, welcome to Doc Talk. Doc Talk, as you remember, is the podcast that is put out by the Knoxville Academy of Medicine, where we talk about health issues that are affecting all East Tennesseans in plain language. And today I am so happy to welcome to our podcast Dr. Afshin Skiba, who is with Premier Surgical Associates and does vascular surgery. Hi, how are you?
It's great to be back. It's great to be back.
We're going to talk about something a little bit different today. If you remember, one of our previous podcasts talked about peripheral vascular disease, and we're going to talk about a great big old vessel in our body called the aorta, right?
That's right. Yep.
Okay, and we're going to talk about aortic aneurysms. So first, what is the aorta?
So the aorta, it's the main pipe that comes off of the heart that feeds blood to our entire body. So when it comes up, it makes a U-turn in the chest, and it comes down through the chest into the belly, and then it splits into two to give blood flow to both of our legs. But really, everything in the body, our head, our arms, our legs, all of our organs, they receive blood from branches off of the aorta. So it's arguably one of the most important blood vessels in the body.
Big old tree trunk.
A big old tree trunk. Yes, it's a major pipe.
Okay, so issues with the aorta then can cause lots of symptoms elsewhere, right? Potentially,
yeah. And so there are a number of different problems that people can have with their aorta, but the most common one is aortic aneurysms, and that's where this pipe, although it may be normal along most of its extent, it'll go from being normal to being a bit on the wide side to going back to being normal again. And they usually use a measurement of 1.5 to 2 times the normal caliber to say, gosh, now that's an aneurysm. And that's the most common type of aneurysm, where it goes from normal to big to normal again. That's called a fusiform aneurysm. It kind of has the shape of a spindle, for example. Another kind that we do see commonly, but not as common, is something called a saccular aneurysm. And that's where the pipe itself is really normal along its whole extent, except there's a focal weak spot where you get kind of an outpouching, or a sac, if you will. It's kind of like if you drive your car into the curb and you get a little bubble on the wall of your tire, a weak spot. It's kind of like that, where if that blows out on the highway, you're in big trouble. And same thing with these saccular aneurysms, that those are very dangerous, and really at any size, they need to be fixed.
That's a great analogy, because tires on a car, they're layered rubber, and then they're reinforced with a layer of steel, and then another layer of rubber. Yep. And so the aorta is like that too, right? It's got like cells and muscles and cells.
Right.
Okay.
A bunch of different layers, and although there are different causes to aneurysms, in general, when you have that kind of weakening, it's because that structure, as you mentioned, has broken down, it's degraded, and it's become weak.
Okay. All right. Is it dangerous then?
Absolutely, yeah. So if you can imagine blowing up a balloon, for example, as you continue to blow it up, the material starts to become really thin, and eventually it will pop. And that is the natural history for aneurysms as well, is that once the wall is weakened, it will just continue to grow over time, and eventually it will also pop. In the world of aneurysms, that's called a rupture. And when that happens, it's incredibly lethal. About 80 to 90% of people die when that happens. It's such a ferocious bleed. And so the whole point, if possible, is to fix it before that happens. And you'd think that, well, maybe it's not that common. Gosh, if the aneurysm ruptures, am I really going to...
Keep talking, darling.
Am I really going to be in a lot of trouble? And as it turns out, the answer is yes. So over individuals over the age of 65 in the U.S., about 3% of people have thoracic aortic aneurysms, these aneurysms in the chest.
Okay.
And 4 to 5% of people over the age of 65 have them in the belly, in the abdomen. So that means 4 to 5% is 1 out of every 20 to 25 people over the age of 65 has an aneurysm like that. And that's a big chunk of people. And when you talk about the mortality, it's on the list of being some of the most common causes of death in the U.S. Thoracic aortic aneurysm rupture, is 15th, and abdominal aortic aneurysm rupture is 13th, as in terms of the most common cause of death in the United States. So it's prevalent and it's a big deal.
Okay, so do I have to get screened for it?
Well, ideally, yes. There are certain risk factors. There are
Okay.
certain risk factors. So these don't happen to teenagers. Usually once people get in their 50s, 60s, or 70s, that's when we begin to see them. And so age is a big one. So to be screened, usually you have to be over the age of 65. Another big risk factor is smoking. The vast majority of people that have aneurysms like this are heavy smokers, usually for their entire lifetime. Gender is a big one. I know when we spoke last about varicose vein trouble that was a lot more common in women. The opposite is true with aneurysms, that there's a big male predominance. It's about 5 to 1 actually, so it's much more common in men. And lastly, and this is an important one that unfortunately is missed from time to time, and that's family history. If a first-degree relative has an aneurysm, then the risk of you also having an aneurysm is about 15 to 20%. So that's 20% is 1 in 5. So that's a pretty high risk. So
that's mom, dad,
brother, sister, yeah,
Okay.
any first-degree relative that's in basically immediate family that has an aneurysm or any kind of aneurysm trouble, then once you hit the age of 65, you really should be screened to have that evaluated.
And just like with women in the lower limbs and vascular problems like that, screening's easy.
Yes, yes. And also, it's covered by Medicare. So
Even better.
Yeah, there were a number of guidelines where originally they just had these recommendations of who can be screened, but eventually Medicare came on board and they said for people of any gender, once you hit 65, if you have a family history, you qualify for a screening ultrasound for an abdominal aortic aneurysm. And for men who are smokers over 65 also qualify. And then the most recent guidelines come from the Society for Vascular Surgery, and these are just from 2018, so just last year, where they said, doesn't matter what your gender is, if you have ever smoked or you have a family history and you're 65 or above, you need to be screened for an abdominal aortic aneurysm. And you're right, it's just a simple ultrasound. It just takes a few minutes, and so it's an important test to get.
That's fascinating. So, just for viewers who we've gone over ultrasound before, but ultrasound is just where they put a wand
Yeah.
on your stomach, and it doesn't poke your skin or anything
Right,
like that,
right.
and it just goes across it, and it's actually by sound waves able to see the structures
Exactly.
underneath your skin.
Exactly. Yeah, they put a little cold jelly on your skin, and this probe just uses high frequency sound waves, which means it's just beyond our ability to hear, hence the name ultrasound. And it just looks at the inside, and it's very easy to see the caliber of these blood vessels. It's a very simple test.
Okay, and that would be for men over 65, smokers.
And men or women who have a family history. And that was the original Medicare for their Medicare coverage for screening.
Okay.
But as I said, with the most recent SVS guidelines, they say doesn't matter your gender. If you've ever smoked or have a family history, and if you imagine all the smokers in this part of the country,
Right.
and you're above the age of 65, then you qualify for screening.
Oh, that's a lot of people.
That's a lot of people. That's
But
a lot of people.
ultrasounds are not painful, they're not risky, and they're
Right.
not expensive.
Exactly.
And there's no
exactly.
radiation,
Exactly.
which is
Yep.
great.
It
Okay.
is great.
All right. So, okay, all risk factors aside, symptoms.
Yeah.
If we're not screening, we're at the level where maybe,
Yeah.
yeah.
Yeah. So when it comes to symptoms in aortic aneurysms, unfortunately, most aortic aneurysms are asymptomatic. People usually don't know they have them until they become very
Even
large.
more reason to screen.
Even more reason to screen. Now, it is a little bit more common that people who have a thoracic aortic aneurysm, an aneurysm in the chest, will have symptoms. And just because there's a little more high-value real estate just kind of packed into a small area, excuse me, if there's one of the nerves that wraps around the aorta, when that gets kind of stretched by the aneurysm getting bigger, then you can have voice changes in the form of hoarseness, the recurrent laryngeal nerve. Sorry, I keep knocking this off. If the esophagus, the swallowing tube, gets compressed upon, then you have a little bit of difficulty swallowing, dysphagia. If one of the branches of the windpipe gets compressed by the aneurysm, then you can have a little bit of difficulty breathing, dyspnea. And of course, it's right next to the spine, so some people experience garden variety back pain, which is in fact from the aneurysm. In the belly, it's a little less common than in the chest because I would equate it to being, in some ways, like a pelvic cancer, like an ovarian cancer, where these can potentially become very large because it's so easy to displace the other organs in the abdomen without necessarily causing any pain or discomfort, that these abdominal aortic aneurysms oftentimes are not picked up unless it's a screening study for something else. Maybe someone has gallstones or a kidney stone and they get an imaging study for another reason, and lo and behold, they have a giant aneurysm in there.
Yeah, that's where I hear most of them get picked up.
Yeah.
But with great technology now, I mean, before, when I finished medical school, we had very limited means of addressing an aortic aneurysm, whether it was in the chest or in the belly. And now you have so many different ways you can address it, and it's not something to be scared of.
Right. So when someone comes to our clinic and they have an aortic aneurysm, whether it's in the chest or the belly, the first decision tree is, does it need to be treated right now, or can we safely watch it? Because, of course, any kind of procedure, you have to weigh the benefits of surgery against the risk of this thing potentially rupturing. And so if they're smaller in size, you actually can safely watch them for a period of time. And when we do that, it's a pretty robust surveillance protocol where we watch them serially over time with these ultrasounds and other imaging tests. But for those that do need to be treated, the branch point is either open surgery, which is the way it was done for many years, or newer technology that we have now with these endovascular stent grafts. And the difference is that with open surgery, although it's a more, the repair lasts longer in terms of needing fewer re-interventions down the road, it's about 5% or less, it's a big upfront hit to the patient because it's a big incision in the chest or a big incision in the belly. You replace that diseased aneurysm with a flexible plastic tube, a graft that's specifically manufactured for that purpose, and you hold it in place with stitches. It has a fairly reasonably high risk of heart attack, stroke, death, blood transfusions. You're in the hospital for a whole week or longer sometimes. But now with our endovascular procedures, all of that has really kind of flipped, where the risk of heart attack, death, stroke, blood transfusions is way down. For most of these people, it's just an overnight stay in the hospital. It's poke holes in the groin and maybe a third poke hole in the arm, and the people are back to their lives in a much shorter period of time. The one drawback, though, with endovascular procedures is that the risk of needing additional procedures down the road is a little bit higher. Instead of 5% with open surgery, it's more in the range of 15% down the road. But thankfully, even for those people that do need a re-intervention down the road after having an endovascular repair for their aneurysm, still it's usually just another needle stick procedure. It's not big surgery.
That's just phenomenal.
Yeah.
Okay, so we've got this pipe in our bodies, right? And it's blown a section.
Yeah.
It's got a weak section, a
Right.
bleb,
Yeah.
a sac.
Yes.
And you can go in with just little holes and catheters and reinforce it so it won't pop.
Right. And it's the same type of graft, that flexible plastic tubing, but the difference is that since you can't hold it into place with stitches when you're working inside the blood vessel, you have what's called a stent. It kind of looks like a Chinese finger trap, or if you can imagine a small chain link fence that's kind of wrapped into a tube, and when you release it, it pops open, and that radial force holds the graft against the wall, hence the name stent graft. And so it works great, but as I said, it's not quite as nice as the open surgery, and so it does down the road. There are certain types of endo leaks and other issues that they may have, but again, these things are all, if they happen, are usually very easily fixable with needle stick procedures.
I love that.
Yeah, I would say about 90+% of aneurysms nowadays, whether in the chest or the belly, are fixed with these endovascular stent grafts.
And because everybody's different, those stent grafts are very customized.
Right. So they do have a wide array of different sizes and branches and whatnot, that if you wanted to fix one, right on the spot because it's ruptured or whatever, then, all of those different things are available. For people that have more complex aneurysms that involve some of the branches, like to the kidneys, for example, there are customized fenestrated grafts, as they're called, that we can have, where we sent imaging, and actually they're built in Australia, and they build custom for that particular patient's anatomy a graft that is specific for their anatomy, and then 5-6 weeks later you get to implant it, and they're fixed.
That's just so cool.
Yeah, it's pretty amazing.
That's just so cool. I
Yes.
can't wait till we have stem cell grass.
That would be
Custom stem
nice.
cell.
That would be great.
All right, so I think we got the basics.
Yes.
Okay. We need to be screened for them.
Need to be screened.
If you're male, smoker, over 65,
Yes.
screening's just an ultrasound,
Correct.
painless,
Yes.
preventable.
Correct.
Mortality is high because they're silent.
Right. And if you can detect it before it's ruptured, then you could prevent that major life-ending event. And as you said, screening ultrasound is a simple thing. And if you do need surgery to have it fixed, it's a couple of poke holes and an overnight stay in the hospital for the vast majority. So it's not the way that it used to be.
I'm so glad that you care. I'm so glad that you care and come and talk to us and
Of course.
and get all those men who need to take care of their families and women, but men who take care of their families and
Right.
prevent something horrific from happening
Absolutely.
to that family. If
Absolutely.
we have more questions, how do we get a hold of you?
So our office is off of Paper Mill Drive, 6408 Paper Mill Drive. It's right next to the Holiday Inn Express. And our office number is 588-8229.
Okay, Afshin, thank you so much.
It's a pleasure speaking with you again.
And that's a wrap for today. Thank you.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.